Health experts are pushing for the extension of current quarantine classifications in light of the threat of the Delta variant. Greg Gregorio now reports to us live from Mandaluyong to give us more details. Greg, how long will this quarantine status likely be extended, and are health experts looking at just specific areas?
Charles, the vaccine experts panel, specifically Dr. Ronjin Solante, did not mention any specific areas where he thinks that the quarantine classifications must be extended. But when he was asked if he has a recommendation now that the current quarantine classification will be ending on June 30, Dr. Ronjin Solante said that we need 15 more days to monitor the trend of COVID-19 cases in the country, because as we all know, we are still preventing the further entry of more Delta cases, more cases with Delta variant in the country. Because if we remember, this Delta variant of SARS-CoV-2 has the 60% more transmissibility than the Alpha variant, and according to Dr. Solante, we need to monitor for us to sustain the decreasing trend of COVID-19 cases, especially in the National Capital Region that we have been seeing in the past weeks. Charles?
Greg, do we have any new information on how effective the current batch of vaccines are against the Delta variant, at least according to health experts?
Charles, based on the presentation of Dr. Ronjin Solante in a virtual press conference earlier, there are only two COVID-19 vaccines who have their data so far as to their vaccine efficacy as affected by the Delta variant. One of these is the Pfizer vaccine, which, according to their clinical trial data, has 95% efficacy, but when it is affected by Delta variant, this efficacy went down to 88%. The other vaccine is the COVID-19 shot of AstraZeneca, where it was reported to have 67 to 80% efficacy based on their clinical trial, but as affected again by the Delta variant, it went down to 60%. But despite this decrease, Solante is saying that everyone must still get themselves vaccinated, because this will be a way for us to reduce the chances of more infection and the possibility of more mutations of this SARS-CoV-2 virus. Charles?
Greg, we've been hearing buzz about booster shots or maybe taking a third dose of certain vaccine brands. What do we know so far about this?
Charles, Dr. Solante, as well as Dr. Isagani Padolina of the vaccine expert panel, are insisting that while we are still studying the need and the possibility of having a third dose as a booster shot, they do not recommend it as of the moment, because what they want to emphasize is we have to get everyone vaccinated first before we go into this third shot, because there is also this concern of the scarcity of supply of vaccines across the globe. Thus, it is more important to have everyone to the protection first before we go into the possibility of having another shot or another brand of vaccine as a booster for that matter.